Senator Young.
Thank you, Chairman. Good to be with you, Mr. Secretary. Welcome to the committee. The world is facing an antimicrobial resistance crisis. I know you know that superbugs make us all more vulnerable. They undermine treatment of everything from common ear infections to cancer treatments and routine surgeries. We're seeing more resistance to an infection right now than we ever have before. And blessedly, there's been a lot of public attention that has been paid to this. The antimicrobial market is failing. They're hard to develop. They're almost impossible to sell for at least 5 years because of the need to hold new antimicrobials in reserve to prevent resistance to those antimicrobials from developing. The administration has stated that drug resistance is a crisis. And the budget highlights a program to provide an incentive for novel antimicrobials, similar to the Pasteur Act, which is bipartisan legislation that I have introduced with Senator Bennett. Just days later, after the budget was submitted, CMS rolled out a list of 27 medicines that the Inflation Reduction Act is going to penalize for price increases. 5 of them are antimicrobials with prices that are overall well below the total expenditures of other classes of drugs, and they're generally used for short durations for acute infections. These are infused medicines, the kind that you get if there's nothing else available to you. So, Mr. Secretary, I'm going to give you an opportunity to tell me, how will penalties on these antimicrobial medicines help our superbug crisis?
First, Senator, you're the only one that has asked a question about antimicrobial resistance, and I thank you for that, because we don't think about it, but we're losing the effectiveness of some of these drugs, like penicillin, and we count on it, but because it's being overused or misused, we're losing the effectiveness of those drugs, and so thank you for posing the question. Secondly, remember that the only drugs that will fall on this list to rebate back some of the money is drugs that were raised beyond the rate of inflation. And they can't be new drugs. And so these are drugs that have been on the market. And that manufacturer would have to explain why they had to increase that drug beyond the rate of inflation, in some cases dramatically beyond the rate of inflation. And so we're trying to be careful here, and we're going after only those drugs where we see the price is being hiked dramatically.
The price increases on these antimicrobials are based on relatively low overall cost compared to many other disease treatments. I don't think that patients are going to see much benefit from the penalties that are imposed by the Inflation Reduction Act, if any at all. It seems like a pretty arbitrary penalty to me that could impact development of new antimicrobials, which you just indicated we really need to develop them. Yeah.
And I would love to follow up with you any way you'd like on that, because you've touched on something that's really important. We have to figure out a way to have a consistent flow of new drugs that combat bacteria. And as you mentioned, it's a tough business. There's not as much money in it as you might think. And so definitely interested in following up with you in any way you'd like.
I'm interested in working together on this. I know the administration, through their budget proposal, has indicating something, they support something seemingly similar to the Pasteur Act. Maybe you can just share with the committee how that proposal, you imagine, might strengthen the antimicrobial pipeline.
Part of what we think may be in the solution is, rather than have a manufacturer produce a good drug and now try to market it and depend on the market actually receiving the drug and buying it, is maybe have more of a subscription model, where what you do is you say to the industry, come up with a drug, and like these subscription services, Netflix and all the rest, everybody pays in a little bit. This way there's always money in the pot, and these manufacturers have an incentive to go forward with their production and creation of the drugs, because they know that there'll be money in the pot. Most of these manufacturers are afraid that there won't be a market for their drug.
Sounds very similar to the Pasteur Act, and all the more reason we should work together on this moving forward. Mr. Chairman, if I could just add a very quick question about organ procurement, something you've been such a leader on.
I was just going to commend you, because yesterday we got some good news that the administration is going to be receptive to recommendations that you and others work with all of us on to have a more competitive system and not just give out the contract. So I was just getting ready to praise you.
Oh, well, thank you. Thank you for that. And I'll just pointedly ask the Secretary
Please.
on topic here.
Please.
Getting OPO process data has been a real challenge. The chairman and I have both requested this data. We think it's consistent with our oversight responsibilities in ensuring that more organs are available to save more lives and extend lives. So will you commit to release OPO process data in line with the bipartisan calls from this committee?
Senator, we're working to change the way we handle organ procurement and transplantation. And we're definitely interested in working with you on this subject. And I don't know if you heard, but we just announced that we're doing 3 specific things that are changing the dynamic in this space. We're going to call for more data transparency from the contractors. We're actually going to open up competition for the contract so that the same contractor that's had this for years and years doesn't just expect that they will get the contract. And then we're also trying to, and the President's budget calls for more resources to actually modernize our IT, because if we're not keeping up with technology, we're losing time, which could be letting an organ go to waste.
Those seem like the right priorities. I would say that I hope the OPO process data is forthcoming, consistent with the data transparency focus. Thank you so much.